You are welcome to NSC 209 Health and Physical Assessment class. Today we'll be looking at the role and responsibilities of nurses in health assessment. As nurses, what are your roles and what responsibilities do you have in health assessment? That is what we want to look at today. So like I have said earlier, that we have to look at our roles as nurses and also responsibilities in health assessment. So we have two objectives. One, to describe the roles of nurses in health assessment, and to also describe our responsibilities in health assessment. Basically, for you to remember that health assessments are used by nurses to gather information about a patient condition. And based on the use of this information nurses gather, will take us to the roles of nurses in health assessment. Nurses use information gathered to formulate nursing plan of care for the patient. They use this information gathered to manage problems of patients. They use this information gathered to also evaluate patient condition. They use it to prepare discharge teaching. And lastly, they use it to advocate for the patient. We shall look at this one after the other in this discussion. To formulate a nursing plan of care for the patient, a nurse takes note of actual or potential problems her patient may have during a health assessment. From the list of problems, she formulates diagnoses which she used to create a nursing care plan. Managing problems of patients. The nurse continuously does a health assessment on her patient to see if her care plan is having the desired effect. If not, she makes changes to her care plan to address the patient health problems. Thirdly, nurses' responsibility or role in health assessment is to use information gathered to evaluate patient condition. Evaluation of a patient health status is done through health assessment to determine if a patient has responded to nursing care sufficiently enough to be recommended for discharge. The information nurses gather during health assessment of a patient are used to prepare discharge teaching. During a health assessment, a nurse may become aware that a patient is lacking information that may help improve his or her condition. This provides the nurse with an opportunity to impart this information before he is discharged. Lastly, information nurses gather during health assessment are used to advocate for the patient. So as a nurse, your role in health assessment includes to use information gathered to advocate for the patient. When a nurse performs a health assessment, she may find a problem that requires the expertise of other members of the healthcare team. In this case, the nurse notifies the proper or appropriate healthcare team member of the problem and makes sure the patient receives the expert care that they need. Here she becomes an advocate for her patient. The next thing we'll be looking at, you have seen your role as nurses in health assessment. We are looking at your responsibilities in health assessment. As nurses, you have responsibilities to play in health assessment. We'll be looking at them one after the other. You have the responsibility to carry out health assessment on every person under your care. 2, you should regularly perform focus assessment in response to client need. What do we mean by focus assessment? When you look at your patient or your client, different from the general information you have gotten before at the point of admission, if the client have a specific complaint, you have to focus on that aspect and assess that aspect that the client has complaint on. Thirdly, the nurse needs to obtain client consent prior to health assessment. You have to seek for your client's consent. It's not that because you have come to the hospital, I have right over you, and you cannot just touch the client or your patient anyhow. You have to seek for their consent. So as nurses, it's your responsibility to seek for your patient or client consent. You should demonstrate a caring attitude, respect, and concern for each client when doing a health assessment. Yes, the client or patient has come to you as a carer. You should be able to have a caring attitude. Respect that client. Respect his or her personality. And treat each patient or client as an individual when doing health assessment. It's your responsibilities. You have the responsibility in keeping confidentiality about the data being collected from your client. As your client comes to you, during health assessment, every information you gather must be treated as confidential. As part of your responsibility as a nurse during health assessment, you obtain information on a client using various techniques and tools such as history taking, physical examination, reviewing client's record, and result of diagnostic test. Based on this information gathered from these clients, you have the responsibility to draw inference in order to make appropriate and sound clinical judgment. 7, you have to acquire specialized skills and competence in collecting accurate and relevant information on the patient health in performing health assessment in order to make sound clinical decisions. As part of your responsibilities as nurses, you should document the result of health assessment, analyze the data collected, evaluate the client response to health problems and interventions, and provide feedback to the clients as appropriate. It shouldn't be that patient or client are forcing you to communicate with them after your assessment, after you carried out any procedure on your client. It is your professional obligation to give feedback to your client as appropriate. You should continuously advance your competence in health assessment throughout your career, your nursing career. As nurses, you should be able to aim higher. That yes, the way you conduct health assessment yesterday become obsolete tomorrow. That is why you have to keep updating yourself. And lastly, you have to take an advanced practice role. And what does that mean? For you to be able to perform advanced and focal health assessment, you have to keep developing yourself. Especially when you are dealing with clients, the way you are able to conduct your health assessment, we have a role to play in your nursing care that you carried out on that patient. That is why you have to keep on updating yourself as much as possible. With this, we have come to the end of today's class. Bye. See you next week.